Our studies have taken us into a study of the HPB systems, hepatic, pancreatic, and biliary systems. Here are the structural organs of those. We make sure that you're refreshed on the anatomy. That has implications for function. So we ask the question, when we talk specifically about the liver, can you live without the liver? Well, we need to have clarity about what functions are occurring at the liver. So, in the liver. So make sure that you review what those functions are. They include synthesis and storage of amino acids, proteins, vitamins, and fats. In class, I gave you a handout on the role of vitamin K in keeping our bones healthy and helping us with proper clotting of blood. People who have low vitamin K as a result of cirrhosis of the liver lose that function. And then blood glucose regulation. You're aware that the liver is a great place to store 2-molecule sugar. 2-molecule sugar doesn't work in the vascular system, in the hematological system. And so that has to be lysed in order to be 1-molecule sugar. So that's happening in the liver when there's a call for more energy. Then glycogenolysis occurs, and there's a dumping of single-molecule sugar into the bloodstream. Bile drainage. So the bile that's produced in the pancreas, or I'll say bile produced in the liver, and then the gallbladder can cause that to be more concentrate. And if there is lithiases, stones that collect there, and the bile doesn't get to the intestines, this is when a person will have jaundice and upper right quadrant pain. We've got to have bile for normal digestion, and if a cirrhotic liver occurs, that's compromised. And then blood circulation and filtration. You know that one of the roles of the liver is to receive what's coming in the way of foodstuffs from the gut, and also to receive poisons that are coming in to detoxify. So there aren't enough healthy livers in the United States of America or in the world. People who have had persistent liver injury have worn out their liver, or it may be as a result of autoimmune diseases. The body's attacking its own liver. Anyway, persistent irritation to the liver, hepatitis, persistent inflammation leads to fibrosis, which leads to cirrhosis, and that leads to liver failure. If we're putting poisons in our body, excessive alcohol through drinking alcohol beverages, or acetaminophen, or too much of really anything. One of the filtration systems is the liver, and we can damage our liver as a result of that. And then we worked in class on circulation of blood to the liver and from the liver. So in through the portal vein, out to the general circulation, central circulation, through the hepatic vein. When the liver is damaged, or if there is HPB injury in any of those three systems, the acute abdomen can result. Here, causes of this. This is a non-specific, rapid onset crisis in the abdomen. Acute abdomen is used in medicine to indicate that this is an emergent circumstance. So the reason I put this in quotes is this is the language that would be used in the ER if a person has a cholelithiasis or they're in liver failure. If something's not done, then the morbidity that comes from that is a pretty big league. The types of hepatic insults can come from viral infection, toxins that the body isn't clearing. For instance, in a cirrhotic liver, the ammonia that's produced in biochemical reactions is supposed to be cleared, but if the liver is defective, that ammonia gets to the central nervous system and can be problematic. Autoimmune disease, and then alcohol. Signs and symptoms of liver disease are listed for you in the E-class and then highlighted for you in subsequent plates. I want to demonstrate asteriscus. If you have a client who's in this position, let's say that they're in physical therapy, and you ask them to extend their hand, they can't maintain this because their neuromuscular system, their nervous system is poisoned, usually as a result of ammonia, and they'll hold it up and then it drops down, and then there's a reflexive response, and so it's called liver flap or asteriscus. You're way familiar that if bilirubin is not appropriately dumped into the digestive system and it's retained and filtered in the urine and disseminated by the central vascular system, then the person will become jaundiced. They can develop spider angiomas. There's asteriscus. Those are all available to you. We had liver in class, a nice, smooth, sharp-edged liver compared to cirrhotic liver. Another complication from liver disease is very high blood pressure that can result in varices, and there's provided for you previously other examples of varices, but this is the one where a person has such high blood pressure through the splanchnic vessels that they develop these varicosities in their esophagus, and they'll develop a cough, and it will be they'll express hemoptysis, blood in their cough. This is a major sign of advanced liver failure. And then we talked about viral hepatitis, the means of transmission of these different types, and what the morbidity is, and whether there's vaccines or not. This is way important. The reason I've color-coded this is that A and E are similar and might be present in the same client. B and D might be present in the same client. The means of transmission is the same. Obviously, there's vaccinations for A and B. There is not for C. And so being familiar with this is worthwhile for you in healthcare. Toxic hepatitis, these are some of the agents that can lead to toxicity in the liver, and person might have immune system response, an allergy to this, and or it may very well be that the amount of these things consumed can lead to overtaxing the liver, lead to inflammation, and then the progression of liver damage can take place. Just a real quick note, neoplastic changes in the liver. The liver can be a primary or a secondary site of cancer, and one type of benign neoplasm is a hemangioma, and I've given you an example of a hemangioma on the skin. It's a blood-filled tumor. Hemangioma is a tumor, hema is blood, and this can happen in the liver because there's so much blood in the liver. And if it's a reasonably small hemangioma, not treated, but if it's very large, it may have to be drained. A person who has this kind of a neoplastic change is not allowed to be in contact sports. And then appreciate the fact that there can be some predisposing medical conditions that lead to cancer of the liver. Persons who contract the Hep C virus are very vulnerable to cancer. And secondary metastatic results where cancer was primarily in these various tissues or organs that then spreads to or metastasizes to the liver. The pancreas, you know, is where aldosterone and insulin are manufactured, and the damage to the pancreatitis, can be a result of alcohol abuse or cystic fibrosis, and the symptoms are listed for you there. Pretty dramatic symptoms. You won't miss this, and obviously this would be a referral. This is a very painful condition, and there is morbidity associated with it if it's not checked. Very, very difficult diagnosis. One of the more difficult diagnoses that we'll be a part of is pancreatic cancer. It's almost 100% fatal, and the progression of the disease is very fulminant because it's an insidious disease and it's not caught typically until they're in stage 4. The majority of people who are diagnosed with this will be gone in weeks or months. So the staging for that is through the TMN system. And then cholecystitis is inflammation of the gallbladder as a result of stones in the various levels of the duct. This is the common bile duct. This is the pancreatic, excuse me, I beg your pardon. This is the common bile duct. This is the bile duct. And triggers for setting off this inflammation are high-fat meals. A person could have a high-fat meal and go into extreme pain. Central, they may think they're having a heart attack. So people who are prone to cholecystitis have to be on a very low-fat diet. Cholelithiases are actually the stones. Here's a gallbladder that's just filled with gallstones. And when they come through these narrow ducts, the hepatic duct, the common hepatic duct, and the common bile duct, if these get lodged in there, it's excruciating. And the treatment for this, if it doesn't have to be, the intermediate step is to drop their pain. People will go to the emergency room with this because they're in so horrible pain. They're vomiting from the pain, and and the treatment for this is lithotripsy, where sound waves are focused on where that cholelithiasis would be, and then if that's not successful at breaking that lithiasis up, then there may have to be a cholecystectomy where they use a laparoscopic procedure, do microsurgery, and go retrieve it. Okay, bless you. Take care.